Hello everybody, it's obstetric and gynecology made easy. Today we are going to talk about penicillin. And let's start with mode of action, and the mnemonic is ladders of penicillin. It's combined with penicillin binding proteins and inhibition enzyme called transpeptidase, which is responsible for cross-link formation between layers of peptidoglycans, lead to instability and cell death. We can remember penicillin by this photo memory. Penicillin form of two-part pen and cell. Let's imagine that we have pen which is directed toward the cell wall of bacteria. Preparation of penicillins. The mnemonic is ladders of penicillin. P4 anti-pseudomonas, which include carboxypenicillin and uriidopenicillin. Carboxypenicillin like ticarcicillin, carbapenicillin, and piperacillin, and uriidopenicillin like piperacillin, which has activity against pseudomonas. We can add beta-lactamase inhibitor like tazobactam to broaden its spectrum and increase its efficacy. E4 extended penicillin, which include aminopenicillin and anti-pseudomonas. Aminopenicillin like ampicillin and amoxicillin. We have two N ladders, so we have two natural penicillin G and natural penicillin V. We can replace C ladder with S ladder, so we have anti-staphylococcus like oxacillin, cloxacillin. S ladder to remember that it's stable against GIT acidity and beta-lactamase enzyme. So S for stability. We have two L ladders, so we have two long-acting penicillin like benzazine penicillin and procaine penicillin, and I ladder for inhibitor, beta-lactamase inhibitors like amoxicillin plus clavulanic acid and ampicillin plus sulbactam. Side effect of penicillin. The mnemonic is ladder of penicillin. P4 platelet dysfunction, which is common with ticarcicillin, especially if administered with other antiplatelet. E4 direct hypersensitivity reaction, which include xanthema, xenophilia, edema, and elevated temperature. N for nausea and GIT upset, and 2I ladder for injection. If the penicillin injected locally, it leads to irritation, and if the penicillin injected intrathecal, it leads to neurotoxicity and seizures. C4 cation disturbance, with sodium or potassium salt, which is common with carbapenicillin. And C4 cross hypersensitivity. Hypersensitivity reaction to one type of penicillins makes the patient sensitive to the other type of penicillin and occasionally sensitive to cephalosporin. 2L ladder, L for leukopenia, diminished white blood cells count, and L for liver dysfunction, increased liver enzyme, and IN for interstitial nephritis and intestinal flora disturbance, which lead to diarrhea, occurs with broad spectrum and completely absorbed agent like ampicillin. Pharmacokinetics. The mnemonic is ladder of penicillin. B. Poor oral absorption, which is common with penicillin G, and better with penicillin V and staph and amoxicillin, which is acid stable. E. Excreted via kidney, primarily through glomerular filtration and active tubular secretion. N. Non-metabolized largely. Most of the drug is excreted unchanged. I. Intravenous or intramuscular routes, preferred for penicillin G due to poor oral bioavailability. C. Crosses the blood-brain barrier poorly, better during meningitis, when the meninges are inflamed. I. Inactivated by gastric acid, penicillin G, necessitating parenteral administration. L. Low half-life, approximately 30 minutes, requiring frequent dosing. And L. Limited protein binding, around 60%, influencing drug distribution. I. Increased concentration with probenecid, which inhibits renal tubular secretion. N. Needs dosage adjustment in renal impairment and for neonate elderly due to altered excretion. Indication of penicillin and the mnemonic is ladder of penicillin. B. It used for pneumococcal infection and prophylaxis for rheumatic fever. And E for enteric fever. And for Neisseria gonorrhea, we have 3I ladder. So we have infection by Streptococcus, infection by Staphylococcus aureus, and infection by syphilis. C for Clostridium, which causes tetanus and gas gangrene. And 2L ladder, L for Listeria and leptospirosis. And N for necrotizing fasciitis. I hope this helps. Please don't forget to like and share.